Hello, this is Deb from the UAP Medical Coalition, also from Calling All Beings and Deb's Data Dojo. I'm here today to introduce our first mental health panel. We have several guests today who want to talk about mental health related to UAP issues. I'm going to let them introduce themselves, and the first one I will bring forward is Les.
Hi, Deb. Thank you very much for setting this up today. Yes, I'm the co-founder and chairman of Opus, the Organization for Paranormal Understanding and Support. Our mission, simply put, is to help people having paranormal experiences. And of course, we'll be discussing today the many experiences that people having, and also how to best help them. And so our organization has basically set up 3 ways to do that, and I'll discuss that later on. Thank you.
Okay. And Earl, can you go next, please?
Sure. My name is Earl Gray Anderson. I'm state director of MUFON in Southern California, as well as an executive member of MUFON's Experiencer Resource Team. I'm also a retired nurse, and I've worked extensively with experiencers. I've kind of lost track of how many cases I've worked on, but I know just in general, the UFO cases I've worked on are over 900. Add to that the 200 plus experiencer cases, and that's my expertise. And I'm honored to be part of this.
Thank you so much. And June, can you go next, please?
Sure. Hi, I'm June Steiner, and I'm came in through Opus. I was past president for about 18 years. I am a early experiencer from the time I can ever remember, like 2 or 3. And I began working with Leo Sprinkle in the early 80s, seeing clients as I got my degrees and became a therapist, a psychotherapist, and a hypnotherapist. So I have been working with every kind of case in many countries for that many years from then till now. And I've had extreme experience and wonderful connections with people that work in the field all the time. So I'm really excited to be here today to talk about the best way to work with people. Thank you for inviting me, Deb.
Oh, well, thank you for coming. Madeline, can you please go next?
Sure. You can call me Maddie and be informal.
Okay.
I am a retired nurse, clinical specialist in adult psychiatric and mental health nursing. I retired from the VA doing psychotherapy with combat vets and jumped into working with MUFON and then Opus in their experience support teams, helping those who've experienced contact with non-human intelligences. And I've done that since 2016, working with and speaking with a few hundred experiencers.
Wow, that's impressive. Anthony Ross Kennedy. Can you hear me? Oh, we can't hear you.
Uh-oh.
Cut out.
Oh, yeah, go ahead. You're up, Anthony Ross Kennedy. You can go ahead and
Okay.
introduce yourself.
Okay, it's cutting out. So, my name is Anthony Ross Kennedy. I have a bachelor's degree and a master's degree in social work, and I'm a retired Army captain. My experience with the phenomena started as a child, and it was just a lot of strange experience. And I have had experience with the phenomena. It's part of my medical retirement from the military.
Oh, it cut out again. We can't hear you anymore.
That's
Yep,
a shame.
yeah. So Anthony, you're gonna have to check your audio. It cut out completely. Okay, Davey, can you please say who you are?
Certainly can. So, as you can probably tell by my accent, I'm not in the United States. I am David Johnston. I am a professional coach and a mental health first aider, and I'm proud to be a member of UAP Medical Coalition. I myself have had several unusual experiences and certainly UAP UFO contact. And yeah, I'm excited to be here and talk with everybody tonight. Thank you, Deb.
Well, thank you. And CJ, and last but not least, please tell everyone who you are.
Hey there, I'm Dr. CJ Robinson. I'm a licensed clinical psychologist working in East Tennessee. I've been an experiencer since I was a kid, and ongoing having odd experiences, trying to make sense of them also with patients. So that's why I'm here.
Okay. Okay, so we're going to basically open the floor to what you would like to discuss. If anyone has something that they wanted to present they think the public should know about first, please speak up. In the meantime, I can start with a question to throw around the room. The question is basically, what have you seen from experiencers to date? What kind of things are mental health professionals seeing when they're working with experiencers?
Well, I could start because I'm on the Opus support team, and I do not do therapy per se as I am retired. And all I could say is there's a vast scope of type of phenomena that I see, from those who have missing time and believe they were abducted, for those who have conscious recall of experiences with non-human intelligence, and people who become very psychic, become healers, and also those who have PTSD, and those who have had a range of medical issues as well as psychological issues from the exposure to EMFs, electromagnetic fields. So there is a broad continuum of people with issues who come for support, and discerning what would be most helpful for them, whether it's some kind of support by Zoom or Facebook or whatever, or support via support groups, or referral to professionals. That's a beginning. I could talk for hours on that subject.
Well, Les, you've been doing this for over 20 years. Do you want to chime in on what people have been seeing with mental health and experiencers?
Yeah, well, yeah, our organization was founded in 1994, and we're a nonprofit now, 501(c), recognized by the IRS. But what we've set up for these people that do come to us is it's threefold basically. One is we do have a online support group, a totally confidential online support group. We do have a referral network of mental health practitioners, hypnotherapists, psychotherapists, and then the latest addition has been our EST, the Experiencer Support Team. Which is a group of people that have a tremendous amount of background in many, many different types of phenomena to do triage, so to speak, with these people. But as far as what these people are coming to us with is, you know, our organization was set up in a very broad spectrum of phenomena, not just contact with non-human intelligences, poltergeist activity, Kundalini awakening. It's so many different things involved with the quote unquote paranormal. But as it turns out, most of the things that we've dealt with have been people coming to us saying that, hey, I was abducted. I've had these experiences with these entities, and they've done things to my body. They've done things to my mind, and it's quite traumatic. Certainly the beginning phases of it are extremely traumatic. And following up on that, after a while, these people become accustomed to it. And then in the later stages, when it stops, it's almost like the Stockholm syndrome, where they say, "What happened? How come they're not coming to me anymore?" And all those situations in that realm have a common base. But then each situation is different in its own respect. The people are being abducted, they're taken through a wall, through the ceiling, they're taken on board the craft, they're laid on a table, they're probed, and eggs are taken from females, semen from males, and various types of blood, experiments are done on them, and then you have people telling you that they've seen babies on board, hybrid babies. And so once you start going down this rabbit hole, it gets pretty bizarre. And the bottom line is that there is something going on. Um, After a number of research studies, including the one that our organization did along with MUFON back in 2007, called the Omega-3 study, these people do not have a psychopathology. They're not crazy. Something has happened to them. And so what is it? Is it extraterrestrial? Is it interdimensional? Is it time travel? Or is it our military? Or is it all the above and probably anything else you can think of? So it's an incredible phenomena, and these people need help. They need help in a big way, and they need to be listened to, not to be judged, but to be listened to, and to give them the kind of support that they're looking for. Many times it's just the ability to understand that they're not alone, that there's other people having similar things going on with them. And once that happens, it's a great weight off of them, because they can't talk to family members in many cases. They can't talk to fellow workers. They can't talk to clergy, and they're also afraid to put that out there because they're afraid people will feel that they're crazy. And the bottom line is they're not. I mean, many of these people that have come to us have also already gone to a psychologist or a psychiatrist, and they find out that they're not crazy. So then what? What the hell do you do? So anyway.
Okay, Davey has a follow-up on that and is going to go next.
Yeah, so from my point of view, we see, particularly in the US, that there are organizations like Opus that people can reach out to, and we can reach out to them anywhere in the world thanks to the wonders of technology, where we can all be sat here talking together. But I'd just like to ask the group, in light of what Les was saying there, that these people who are having these experiences don't have any pathologies. We're not wackos, we're not loons. These are real events that are having impacts on people. I'd like to just ask the rest of the group, and please feel free to answer whoever wants to. What is the greatest risk that we see for these experiencers who aren't able to seek the help that the likes of Opus and Les are able to provide? What is the biggest risk that we see out there for these experiences? Yeah, June.
Well, if they're not heard or seen, or if they're pushed away, they can go into complete isolation. They begin to feel they're totally crazy. And one of the main things that I work with is to help them see that they're not strange or different, but that they're a bridge between our reality and another reality, and that they are more than normal. They are being asked to further consciousness and be able to walk in both worlds at the same time. And without being recognized or without the help that they can have, very often they'll either, as I say, go into complete isolation, lose their relationships and family, suicide, any number of things. So getting the help they need is vital.
Absolutely.
Go ahead, Earl.
My wife and I had we had 3 different visitations in a week. This happened about 8 years ago. I was already a MUFON field investigator at that point. I had never had ET contact of any sort, and I tried the CE5 thing, and it worked a little too well, maybe. And the first night, I mean, they came through the wall. It was right in our room in downtown Burbank. And I really had nothing in my past to prepare me for it. And I was just confused. And I was scared. My wife thought that I had lost my marbles. But then 2 nights later, she's the one who's shaking me. The room is still flooded with light. It was, time was still kind of weird. Yeah, they had been there. And as horrified as I was that my wife was involved in this, at least then she knew that I wasn't insane. The third night, both of us woke up to, I guess, what you would call the Oz effect taking place in our room again, where uh, sounds were muffled. The light with no source was flooding our house. And this time it was coming from above our house. And both my wife and myself received a telepathic message. We were looking out the window. You couldn't see what was, shining the spotlight down on us. But I was really confused because my state director at the time was a kind of a nuts and bolts UFO guy. He didn't really have room for abductions, visitations, in his pantheon of ufology. And so I felt embarrassed. I just shuffled it under the rug, and I didn't. The only people I'd ever express it to were my new field investigators at MUFON, and I would tell them, just be aware that if you poke at the phenomenon, sometimes it pokes back. Um, Now, in my travels, I'd met Kathleen Marden, and I told her a little bit of my story, and Kathleen met with me for lunch, and I got to tell her what happened to us. She was a non-judgmental listener, and of course, we all know she, with her background, she's Betty and Barney Hill's niece, and probably one of the greatest UFO authorities in the world, is unequivocally. Um, and just the act of being able to talk in a non-judgmental environment and have somebody just accept what I was saying, as crazy and as odd as it was cathartic and healing. And I started noticing good things. My own experience was scary. I mean, it was a DNA farming thing, uh, and it was just very, very confusing to me. But after being able to speak with Kathleen, and oh, by the way, after talking with her for an hour, I said, I might want to join MUFON's experiencer resource team myself. And she said, well, what did you think you were interviewing for the last hour, Earl? you know? So it sounds like a few of us have had anomalous contact as well. And I find that that's helpful, that I have empathy for others. I understand. And these experiences run the gamut. We see people harmed by their experiences. Sometimes I have people that have been healed from life-endangering maladies, and it's a very real thing. And I just I love that I get to help people that are experiencing the same sort of thing.
Well, thank you for helping people, Earl.
Thank
CJ,
you.
in your practice, you have also encountered experiencers, so I thought maybe you could chime in on what you have seen from people coming to you.
Sure. What I've seen, I work with veterans, active duty military, people who have Q clearances, because I'm pretty close to some of the nuclear labs here in Oak Ridge. So it's a really solid bunch of folks, police officers, firemen, that sort of thing, just folks that you would generally trust in your day-to-day lives. And they come in and it always starts with, well, I'm not sleeping, or I get really anxious and I'm not sure why certain things make me anxious. They didn't used to make me anxious, but now, since I had this event, they do. And so we get to talking about it and we rule out all the other, diagnostic stuff. And it's things like psychic phenomena, being able to know things like their intuition's off the charts. And these are big, burly, individuals who are not into woo-woo, science or junk science. They're very, very, very level, very straightforward individuals. So, but also just missing time, and they're freaking out. They're asking me like, well, why do you think that happened? And I'm like, well, let's make sure that you're physically okay. And you just kind of go through the algorithm. And when everything comes back and everything checks, it's like, well, you're not psychotic, you're not delusional, you're not attention seeking, you've not had traumatic brain injury, or you don't have a seizure disorder. You've been cleared in every way we can think of. So what does that leave? and that feels like, because I'm fairly new to this field, so it just feels like I'm offering what's left, and I'm not sure what that is or if it's sufficient, right? So that's one of the things that I'm really just trying to find my way through and better understand so that I can help them.
Mhm.
And I've seen and heard things that I can't explain. I can't.
Mhm.
So yeah.
Yeah.
Go ahead,
So
June.
thank you.
Okay. I was just going to say that because there's such a wide range of all these kinds of experiences, many, John Mack and many of the others early on looked at them being a step towards higher consciousness, others towards creating a new world, and many different reasons why people have this. But I was introduced to it, as I say, when I was just a couple of years old, and I was introduced to it by a little gray ghost that would show up, shaped just like a little white or gray, and he came every night and stayed in my room for about an hour, and then I would ask him to leave, and he would leave. That led to many expanded uh, skills and things, psychic abilities. But what I found as I got into this deeply, which I have been in since the early 80s, is that people need someone who can hear what they have to say without any judgment, as was said, without any fear, without questioning. They just need to know that somebody cares and is not making them wrong. That allows the door for them to open up and go deeper into their experience. Otherwise, they keep it on this level that doesn't help them know what it's about or what's happening inside of them. We have spiritual, we have attacks. I've worked with a number of people in the United States and in Canada who have been attacked. Their brain has been attacked with waves. And it's just amazing what is set up in the world today to make those people wrong, bad, crazy. And we need to be able to hear, to help them to just hold what it is that's happened to them so that they can get to the place of trusting that they are okay. They are not strange. They are not bad. They are not different. So the way in which they're first held in their experience has a huge experience on how they will go forward.
Right.
And
Mhm.
So I wanted to comment, you made the comment about internationally people are having these experiences with some possible technology. And I just want to point out that the government is taking that seriously. We have discovered there is a task force for what they call AHIs, which is anomalous health incidents. However, um, we're still trying to get more information about that. But they even have, if you do the research, they even have a number and an email like for someone to contact them because they are taking those incidents seriously. Um, Experiences, however, do go well beyond the AHIs, and we are seeing a lot of different issues. One of them I've noticed is just the mental health related to people being in the UFO community at all, like whether or not they've had an experience. So, Anthony, I want to give you a chance to kind of chime in here. Let's see if your audio holds.
Yeah. For me, seeing this in practice, I was only in practice for a short period, like 3 years after I came out of graduate school, and having the childhood experiences, but only having those associated with like I only in my head thought that was like ghost stuff, or not even associated with like UAP, like a lot of people, right? But then having clients go through and knowing that I had multiple clients that were telling me about their conversations and channeling and seeing lights in the sky, and then having my reawakening start in 2019 and start having those same type of things happen, like not even understanding what's going on with me, has put me on a path of just like, what is this that we're all awakening to? And oh, by the way, seems to be a lot connected with a lot of service members, right? And then, I know that in my world, I know there's a 1,574 page document outlining the health effects to veterans. And for me, I know this is the way forward for me in bringing it out, is the lens of this has been tracked since 1952. And here's a report on what happens when we get too close to it. And so for me, it's just kind of putting the puzzle pieces together, I guess.
Right. Okay. Great. Thank you, Anthony. So I wanted to again bring up this point. When we talk about the mental health and the UAP topic, we also really need to address the community's mental health, not just the people who are experiencers, or even if they are an experiencer, there's like a side effect of just being in the community. So if anyone would like to address, like I've seen, some malicious behaviors. I've seen people who go off the deep end, lose their jobs, there's a lot of mental health issues related to this topic. So if someone could talk about that, who wants to pick up that ball?
I'm not sure
Okay, I will call on someone.
I've
Davey.
seen people. I believe I've lost jobs. I'm a retired nurse now, but I used to do home care nursing, and there were two different occasions where I was working for families, and I would kind of give them a heads up. I would say, no, I'm a UFO investigator, and sometimes you might see me on a television show or a podcast or something. Well, one of my patients' parents saw me on a TV show, and they fired me because I was interested in this phenomenon. I know of two different, nursing cases that I was working. There still is ridicule and misunderstanding of what this is out there. And I think it's very good that we are able to get the word out that these people aren't crazy, that it's not crazy to study this, that Congress is interested in it, that it's nothing new. It's been happening for, I think, forever. And it just has taken different attributes for different generations. In the 1950s, it was nuts and bolts, and then time goes on, now it's the flying saucer seems to have been replaced by the ubiquitous orb, but it's the same phenomena. I think it's the same entities, and I think that it's coming from all kinds of different sources, dimensional, from our own universe, other planets. We seem to be some sort of a little way station, and maybe we're interesting to our visitors. I don't know what it is, or they're being cautionary. I was going to ask Anthony. I personally I notice that it seems like people in the military, when they have an anomalous event, when they have a visitation or an abduction, it seems like it's sometimes more aggressive. And I'm wondering, perhaps it's because there's this interest in our warrior instincts as a species. Do you have any thoughts on that, or have you noticed that?
This is something that I have directed a fair amount of my study on. And to be honest, we know about the rock bands, the Foo Fighters, right? That word comes out, that comes on these battlefields in World War II. Both the Germans and the Americans were seeing these, and what they were seeing them is these things come along on their missions, and to be present when they were going to do high aggression. But more importantly, if you really start looking at it, they're going when there's going to be a lot of death, right? And they're there, and so you start going, well, what the heck is that about? Yes, it's the aggression, and our military definitely knows about bringing out extreme aggression and the phenomena. And so I think this is something that, as we dig into this, listen, when the veterans wake up to the document outlining health effects from these things, and they understand it's since the 1950s, it's going to remove all of I believe. It's just like this is existing here, people. And so
Mhm.
it is that. They
Right.
come with
So we
depression.
could, I was just going to say we could do a whole nother panel on just the
Hmm.
trauma and how it's
Yeah.
related to
Yes.
this.
Yeah.
So Davey wanted to chime in, so I'm going to let Davey go.
Yeah, one of the things that came up again with what you were saying there, Earl, which I thought was wonderful, and I think we are part of a generational change. So I'm totally open in my world and my life. I work in a very commercial world. I spend a lot of my time traveling around the world talking to C-suite executives, and I suffered from a total breakdown, depression and anxiety, couldn't work for 9 months, went back to work. And I spend my time talking to senior execs about mental health challenges.
Mhm.
They're not in this specific in this specific case necessarily related to the phenomenon and UAP, but I pride myself on being open and communicative about it and actually breaking down doors and changing people's attitudes towards mental health issues in that corporate world. And this is something I have to pass a huge debt of gratitude and thanks to Deb for, because she challenged me on that. And she said to me, what on earth are you doing if you are so open about your mental health challenges and breaking down those doors? What about the stigma around UAP? Why aren't you doing the same? And that's why I'm here tonight, guys and girls, is because that's also I see now as part of my purpose and my reason for being here. And I do think we are seeing a change. And again, over the last probably 5-10 years, we're seeing a broader acceptance of the phenomenon and the fact that there are now government studies into it. I've recently attended academic panels at universities discussing the phenomenon. I'm attending another one next month. So we are seeing an escalation in the seriousness with which this topic is being taken. So again, I'd just like to get everybody else's views on what they're seeing in terms of the change in the stigma attached to the phenomenon and association with it, and what they think's driving that.
Well, I think, Davey, that the fact is that our government here in the States is really starting to open up their kimono, so to speak, on this topic, and which is a good thing. We're approaching it from the nuts and bolts aspects, of course, but the next step is going to be the people that are talking about their contact with non-human intelligences, and so it's coming. I just interviewed John Ramirez this past week. He's a retired CIA, and he had some very interesting things to say about disclosure. That he's believes, and basically he's fairly well connected, that this is going to happen within months, not years, within months. And if that occurs, the floodgates are going to open up, and you're going to have a lot more people coming forward telling their stories about their contact. And some of them are going to be in really bad shape, and others are going to be okay with it. But I think this is why UAP Med has basically been set up to educate the medical community, the mental health community, about a need that's dramatic in trying to understand what this phenomena is and how best to help people. Go ahead, June. I'm sorry, I'm jumping in, Deb. Sorry. I see your hand.
I just wanted to say that the changes I'm seeing, especially in government, is a more open and acceptance and a willingness to maybe open the door an inch or so. But my first client that was sent to me by Leo Spring was a naval officer, and he was aboard ship, and they had a huge UFO experience. They were all called together and told that they never saw it, and they were never allowed to speak it again. When he got back, he did start to talk about it. He got in a great deal of trouble. They ruined his ability to have a marriage, a career, and he was broken down. I mean, he practically had nothing left in his life. And he came in And what I discovered was that he had been hypnotized by the Navy to block the experience.
Mhm.
And he could no longer, give the necessary facts about it. And so I had to go in and break that earlier hypnosis and open his memory back up again to what was going on. But this is just one example of the breaking down of people's just their whole world, and he wasn't able to have any kind of a normal life until he was able to open this and clear up what went on. So I know it's still going on because I have been involved in many instances where there's psychic attack, where there's again energy attack. So it is a phenomenon we really have to pay attention to and help those that have been through those kinds of really awful experiences.
Mhm.
Go ahead.
I find it so gratifying to see that so many mental health people are willing to become advocates, open to the experiences that are happening to people. Unfortunately, after talking with so many experiencers, contactees, I've also heard horrible stories about people going to their doctor, going to the emergency room with panic attacks, being hospitalized in mental health facilities, and even one 70-year-old veteran who went to the VA or his mental health person, and he was told that he's senile, he had dementia. And then he was diagnosed with schizophrenia. Now, this was a combat vet who spent a productive life after the war. And so to have a group like yours, the UAP Med, is wonderful to know that more and more psychotherapists are understanding and opening to this phenomena. And I did want to share a little bit. In 2016 or 2015, I knew nothing about this area, absolutely nothing about UFOs and abductions. And it was only by accident visiting counselors, social workers on the Hickory Apache reservation in Dulce, New Mexico, that I even discovered that, oh my gosh, there's a whole area of ufology. And I went to a conference there a few months later, and that's when my mind got blown. And I started to put together all the various weird events in my life. Well, I'm a contactee too, and I didn't even know it until I was exposed to this. So it's a wonderful world to share with others and also to help others share. So I wanted to share that.
I'm noticing that there is a trend of a lot of people with experiences are more open to helping others. It's really actually
Mhm.
heartwarming.
Mhm.
and, I'm- and we could have a whole discussion about the contrast between indigenous people's experiences and
Oh.
other international experiences and how they're treated as opposed to how people are treated in what people call the Western culture. So
Mhm.
CJ had a comment, so I'm going to let him go next.
Thanks, Deb. Yeah, it's a simple comment. This is, I guess, sort of a clinical observation that, the question of why do you think this is happening, or why do you think, or, what's causing changes in the conversation. For me, in my practice, it's, once someone comes to me, they disclose these things that have happened to them. We rule everything out. And then, so we're sitting there, one human being, across from the other saying, well, what does this mean? And whenever we try to just ignore it or push it away, to say, well, let's just see if it doesn't happen again. Maybe it's just a fluke. Can't explain it. Whatever. No problem. But what happens invariably is there's something that sort of pushes back and says, no, you're going to pay attention. And that's the part that I'm really, really fascinated with, that I'm really curious about is, it's like when you try to deny something, or give it, a voice, then it starts to speak louder or it becomes more insistent. I don't know if that comment makes sense, but
Mm-hmm.
it's just, okay, yeah, what I've seen. So that's why I'm here. I try to be pretty careful about what I get involved with, but here I am.
We appreciate it, CJ. I feel like I need to comment also that, of course, in a regular practice where people are not necessarily seeking experience or support, I have also had clients come forward and talk about experiences. And those are people that we need to help also. And we need to start addressing how the regular practice, and it's hard to say that in psychology, right? But other practices are helping people because there is so many issues related to what has been mentioned before, people being misdiagnosed, people being hospitalized, people being stigmatized. um, so I actually wanted to bring up that one thing I've had discussions with people about, including people from the John E. Mack Institute and Daniel Ingram, is about traditional methods for treating people versus new methods. Do you guys think that we need to have some systematic changes in how people are treated in general when they have an experience?
I would say yes.
Yes, absolutely.
Definitely.
Absolutely. Absolutely. Yeah, there's certain modalities that have presented EMDR and QHHT as far as the hypnosis world that seems to be pretty effective, and that's one thing that the recent study that Opus has done called the Omega-4 study. How clever of us after the Omega-3 is the fact that when we went out to therapists, we had them take a survey. And that was one of the things that came out of that survey was these modalities that seem to be working for them. And so this is the kind of information that needs to be put out there because, we all are singing off the same sheet of music here. And but the next step is, okay, what do we do with all of this knowledge and how do we get that out into the field? To these mental health practitioners, to the medical community, and so that's what UAP Med is all about, as far as that is concerned. So there's and this it's in the infancy. UAP Med is in its infancy at this point, and we're just getting rolling, if you will. And so I think that with the people that are here today on this YouTube. Cast is great. I mean, I appreciate every one of you here, and I'm just looking forward to working with all of you. I mean, it's really great, really great.
Yeah. I'm hoping that when professionals hear us talking, they'll want to join our efforts together. And how do you do that? Well, just to go on the Opus or MUFON support directory, provider directory would be so helpful. There's a great need throughout our country, throughout Canada and Europe, for mental health providers and hypnotherapists for our referral lists, because we have states that have no therapists in there who have any understanding of the impact of contact. So please, if anybody's listening and you want to be on our referral list, go to the Opus website and there is an app and ask for an application, and we'll be glad to process it and add you onto our list, because you are very important people.
Thank you.
I had an interesting thing happen a couple of weeks ago. A therapist had a patient. It was not in my state, and she's talking to this guy, and he was an experiencer, and nobody would listen to him. He experienced ridicule from his family, from his partner, and so she knew about Peter Robbins, and she talked to Peter and asked him if he could refer her to somebody that knew about this phenomenon. And God bless Peter. He actually referred her to me, and she was a therapist. She'd never bumped into this before, didn't think it was a real thing. she thought this guy was psychotic or something, and then she's realizing, no, not at all. He's like very, very intelligent and seems to be pretty well balanced. This thing that's affected his life. I'm the first person that he's spoken with that didn't try to change his mind or try to find out if he had some underlying problem that was causing this fantasy life. His experience was beautiful. He was in the middle of nowhere, and he met tall whites, and there was an embrace involved, and he felt surrounded by love. It wasn't the experience that him up. It was the way that the police officers had seen what happened from a distance, and they accosted him and put handcuffs on him, threw in the back in the car, and they told him, "We have everything that happened. We saw it. We have it on our camera." And then the Forest Service people got involved. And there was some other shadowy guy in a suit that was in the room, and he went through all kinds of terrible stuff that was not done by his entities. It was done by other humans. But I felt really, really blessed that I got to be that person. I can't say that I get any magic formula to make things better, but again, it seems like when people can speak in a non-judgmental atmosphere to somebody that's knowledgeable about this, it is pure catharsis for them, and sometimes the healing is right there. In this case, it was. And the therapist got hold of me afterwards and said, thank you. I didn't know what to do with this guy. I didn't know what to do. I didn't really do anything. I just did what I'm doing here with you guys. I just listened to him and told him that I told him a little bit about my story, and he's got a new friend too. I'm going to keep in touch with the guy. So anyway, just an anecdote.
I just wanted to say about that. You say you didn't do anything, but you heard him, you accepted him. That is what all experiencers need. And that's one of the reasons why Opus began the email support group that goes all over the world, because in many, many places here in the United States, let alone other places, you are immediately made wrong, bad. You're isolated by religion, by any number of things. And those people were sitting there steeped in the pain and not being able to reach anyone who didn't react like what you were talking about happened to your client, where now they were able to go onto an email and talk to hundreds of other people who are having the same experiences. And it's been remarkable how many people are able to now feel comfortable telling their story, being heard, and getting the help they need, because then they're encouraged by Opus and all of the members on the group to move forward and to be brave and to ask for what they need.
Go ahead, Anthony.
I was just thinking about like this. We were talking about like how are we going to stop the stigma and whatnot, and I just wanted to say one of the things that I've been thinking a lot lately about is like, when I talk about the veteran piece and whatnot and bringing that out, because it's already established, right? And as that comes out, it'll come out very quickly, I think. But something that I think we have to talk about that I'm pretty sure happened last week is that that just acknowledging that it's real is going to stop a lot of the mental health illness. And why I think that'll happen is I was live last week on our Senate congressional hearings when they showed something live that me and my family, we've seen 4 times. We've seen it 4 times together, 3 different people, 4 times. And there was 200 other people on there, and there were people on there who were like, oh my gosh, I've seen that as well. And just knowing that our government has all of the technology, everything, video of it right there in front of everybody, I'm positive that had some positive impact on people's mental health and some people's mental health there. For me, it did. So I think the truth coming out may just having truth, the collective lie is hurting us with collective depression, the collective lie about who and what we are, and maybe.
Okay, so I just wanted to point out, that we've mentioned that trauma is a factor in this, but secondary trauma is also a factor. The fact that people are stigmatizing this or ever did, and I, historically speaking, for those who were not aware, the CIA set that in motion in order to reduce how many calls in they were getting at the DIA about UFO sightings. So this whole thing was a created problem. And to me, the craziest thing was that we would ever tell the people defending our skies to be quiet about what they saw.
Yeah.
And nowadays, that's biting them in the butt. That's what happened with the recent spy balloon. They realized we should probably not have done that. So CJ has a comment.
Thanks, Deb. Yeah, just on those lines, just this past week, I saw a Marine active duty who, he does a lot of secret squirrel stuff. That's how I'd term it. And some of the things he can talk about, a lot of the stuff he can't. And so sometimes I inadvertently, will traipse across something that triggers a no response. But sometimes I find something that he needs to talk more about. Okay. So he, just this past week, he said, I really appreciate that we're able to talk about this weird shit, to use his vernacular. And you don't shut me down. And even though I know it from like a nuts and bolts kind of level, seeing things on the screen, reading the reports, that sort of thing. He said, you as just another human being telling me that this experience is something real and something that's outside of the military, but also includes being a human being, that was really powerful for him. So, and I just got kind of tearful, and I was like, dude, thank you so much. But it was just a beautiful moment, and that's why, I think for me why I'm here. So yeah.
Thanks, CJ. Thank you.
Yeah, that's beautiful.
Interesting. Yeah. We're dealing with a reality, a different reality. And it involves consciousness. It involves spirituality. It involves so many different facets. And, I've always felt that these people are on a spiritual journey, not a religious one, but a spiritual journey, the soul, that energy that's within us. And it's able to interact at various levels, interdimensionally, traveling through time, forwards, backwards. I mean, you talk about people that come back with psychic abilities, and they're able to see things. And I've worked with a couple of psychics that have worked with police departments and are able to find, missing people or dead bodies or look into the future and tell people things. There's just so many stories along those lines that are just absolutely remarkable, and it's just another reality that we don't understand.
I think we can agree it is often a transformative experience for people, even if they don't have like all the psychic abilities that some people come forward with, or they don't have entity encounters. Just seeing something that you're not familiar with and have no like way to explain and don't have like a label for, and having to encounter that is going to shock you. It's going to put you into a state of, ontological shock, whatever you want to call it. Like mental health issues will result. And what would be great is if people in the community or in the world at large were supportive of that. They were trying to help someone deal with that. I've seen a lot of people do the opposite and disparage these people. And that's really concerning to me.
I was just thinking in that have to me, I liken the negative phenomena experience to like a person that is just a regular person, and all of a sudden they accidentally may have ingested some plant-based medicines, right? And now they're going to go through an ego death, and like the ego death happens.
Yeah.
And some of that ego death, if you didn't have any context, you're just walking down the street and all of a sudden you're in a really crazy world, and it affects like the inside of you. With no support, we don't know what the orange things in the sky come, and we have no context of the reality of who we are. So we can't even have like something amazing just happened to me, even though it was scary. But in these cultures where they get lifted up, they get like, oh my gosh, you've had contact, and it's like a good thing. And maybe we're just missing out on something just because it's reframed.
Yeah, I think people forget the purpose of mental health treatment is to help someone be functional, right? It's not necessarily to find the cause. It's not necessarily to necessarily explain it. It's just to help them be functional, to live their best lives, as some people say. So I wanted to bring up another topic real quick. We're running out of time, and this is kind of an important issue also. Les and I have talked about this within UAP Med a few times, but people who have serious mental health issues like schizophrenia do also have experiences.
Yes.
People, right, and people who have psychosis can also have experiences. And I feel like we need to bring up, issues like neurodivergence, which is not, by the way, a psychology term. I just want to point that out. That is not a psychology term. That was a made-up term by someone else, but it does address, the autism spectrum, people who have brains that are slightly different, perhaps, schizophrenia, even maybe we could address psychedelic use, right? So can someone sort of broach the topic of people who have these other possible conditions that align with also being experiencers?
Yeah, I'd like to say something. When I do contact someone who's asked for support, not as a therapist, but as a support person, I've had people say to me, listen, I have been diagnosed as bipolar. I'm on medication, and this has nothing to do with that. Same thing with schizophrenia. I have schizophrenia and I'm on medication, and this has nothing to do with schizophrenia. And I'm so glad they are out and talk about, not about their illness, but they accept that this phenomena is in addition. Now, on the other hand, sometimes I'll be talking to an experiencer, and it's unfortunately very obviously that there's mental health issues beyond abduction, and they need to be referred to the appropriate people as well. So it takes a degree of perception about what are you hearing? And this is part of the education for the support teams. What are you hearing? How can you differentiate what might be mental health issues? And these are experiencers who need assistance, and they need to be sent to the appropriate mental health people. And the other thing is, if some of the people that I have spoken to, unfortunately, have been had such negative experiences by their therapists or by people in the emergency rooms that they've considered suicide. So this is an acute crisis of care. And it's really important that the mental health field be open to us talking about it. I'd like to see, though I'm retired, I'd like to see mental health agencies and mental health organizations, psychologist organizations, et cetera, counseling organizations, invite someone who is an expert mental health practitioner, who's knowledgeable, who will speak to other mental health participants at a conference. That would be great to spread the word that way as well, to acknowledge that this is a real phenomenon. Go ahead, Errol.
Love you, Maddie.
I love you too.
I was recently asked to guest on a podcast it's a New York podcast that's just a mental health cast. It has nothing to do with UFOs. In fact, I think the guy, he maybe when he booked me, he thought that he would be trying to figure out what was wrong with me. And he was surprised, and he was very surprised because they got this great, reaction. It was broadcast on YouTube. It's a popular, just a mental health podcast in New York. And I think that if we open ourselves up to those different possibilities that we usually don't look for, I mean, what's the use of preaching to the choir? I mean, all of us, we in the UFO public, they already know that this is a real thing. So a lot of that is just saying yes or go those odd invitations to speak. And I love doing that. Preaching to the choir is boring.
Actually, I'm going to say that Anthony made a comment in our chat, our personal chat, about the cultural competency, and that's something that I get on a platform about that all the time. Like, we are trained as clinicians that we are supposed to be culturally competent. If this is a belief that someone has, you should be respecting that. If this is a tradition that someone has, respect that. Spirituality is supposed to be respected. And like, because spirituality comes from this. I'm not saying that it's not a nuts and bolts experience, but spirituality is connected. If someone believes that there is, I hate to say this, like a galactic confederation, you're supposed to respect that when you're providing mental health treatment. That's their belief. And for anyone to ever be sent to a hospital because they make that statement is beyond me. So I know Les is going to have to go in a minute, so I wanted to give Les a chance to say goodbye before he leaves.
Yeah, thank you, Deb, and thank you again for setting this up. One of the things that is so important to the organization, my organization, Opus, is to be able to help people that are having these types of experiences. And so I put it at our website there, opusnetwork.org, in my box there after my name. If you've got anybody that you know or yourself is looking for help, please contact us. There's a support button on there that you can hit, and you describe a little bit about what's going on and what you're looking for. We give you two choices. One is to be put into the online support group, or two, to have an EST member contact you who will do triage and then find out more about what's going on with you and what you're really looking for. And then also, I forgot to mention, Earl, the fact that I'm also a member of the ERT, the MUFON ERT, as a consultant, and they've been doing a fabulous job, helping people as well. So, and Earl has been a big part of that. So thank you, Earl.
Thank you, Les.
So,
I send people to Opus constantly. That's, you or Maddie, wind up getting all my experiencers in your support groups eventually.
Thank you so much, guys. I really appreciate being here today. And unfortunately, I do have to go, but it's been great, and look forward to seeing this on YouTube.
Well, thank you so much, Les. I
Alrighty,
wanted,
guys.
thank you. I also wanted to say that if anyone who is watching this is looking for experiencer support, in addition to ERT and Opus, which I highly recommend, there's also the For Experiencer group, or the Experiencer group, with J. Christopher King. You can find that through Twitter. I also have a set of links for various experiencer support groups on the UFOconnector.com. So I think the last thing that I would like to bring up today is just what you would like to see change in the treatment of experiencers, best practices, kind of thing, for the final thoughts for today. I will just pass it right over to you, Earl, because you're right next to me.
Sorry, I was changing my little, I put MUFON.com ERT on my name there for you guys if you're trying to, if you want to go and report your experience and talk to a non-judgmental listener, that's where to go. It says report an entity encounter, and that's, you just click on that, and I'll send you to somebody like me. So what was that, Deb, that you wanted to?
Yeah, what would you like to see change when we're treating, like, the public, the mental health professionals in public are treating experiencers? What are your final thoughts on
More
that?
understanding out there amongst the health mental health public that's out there. Just knowing that this is a thing and that there is help out there, and that there are support groups like Opus and others that are out there that I've, I send people to 3 or 4 different support groups, and it's good to know that they're out there. And thankfully, this psychologist who sent her patient to me, it was wonderful. She said that it really truly helped him, that it was cathartic for him, and she was able to break through that and get to his just life issues. But that was like the gorilla in the room for him. So that's what I would like to see, is just that they understand in the health care community that this is a real thing, and that you have to respect the patients and know where to send them.
Yeah.
June wants to go next.
Yeah, I would also, I'd also like to say that what we really need is the people that are becoming workers are trained to understand this process. They don't have to believe it. They need to have some training as to how to deal with it when it shows up in their office. And at this point, there's very few people. There is an organization. I delved deeply into body, mind, and spirit work with my psychology, and the DSM does have a category that's supposed to include unnatural, spiritual kinds of things, but I don't see it being used. I've put it on some of my billings for people, and they seem to accept it, but I don't see it being used broadly. And so I would really push that everybody who's in this field really writes to their who they got trained with, and see if we can't get some much better foundational work for therapists, so that they feel good about what they're doing, as well as not being, harsh to people who come with strange questions. So, thank you.
Yeah, I would like to add that mental health therapists who see patients, clients who are experiencers, contactees, know that both MUFON and Opus have people who will be glad to consult with you if you have questions about what you're hearing. Because sometimes we hear really weird things, and there's no preparation, and we're learning as we go on and helping these people. It doesn't stop for us. We're learning more and more new things about contact experiences, so that if professionals who get a referral, there is an opportunity for us to help them as well.
Mm-hmm.
So I'd like them to know that, both on MUFON and Opus.
Okay, CJ, you want to go next on what you'd like to see change?
Yeah, I think for me, I would just like to get some guidance or change at the organizational level. Like for me as a psychologist, it'd be the American Psychological Association. Is there a division that would be willing to take up this topic and start providing guidance to practitioners, researchers, just everyone across the board?
Right. I just want to do a shout out to Ron Westrom here for a minute, because some years ago, decades ago, he was part of a Roper poll where they attempted to inform the APA about the psychological issues and reality of abductions. That was the terminology that they used at the time. Of course, now we prefer other terms, but he did attempt to do that. They did attempt to start doing conferences and educate people. But I can say in my Psych 101 classes, none of that was brought up. Never, ever. None of my psychology classes, not once. Okay, Davey?
There's not a lot I can add to what everybody said, except that, again, just to reiterate that practitioners out there need to know that this is real, this is acceptable, and to support their patients and their people who are presenting to them. They need to be communicating to the likes of MUFON to Opus to the Experiencer Group, and having those dialogues and opening that communication. And from a totally selfish point of view, the next one of these, I don't want to be the only non-American voice on here. So this is a call out to the people I know in the UK, in Germany, in France, who are also working on these topics and these subjects. Get involved, please.
Yes.
Yeah.
Don't make me come on again.
Yeah, we know.
like you, Dave.
Well, Davey, to be fair, we have to point out that we know that there's a certain doctor who's trying to do that right now. He's trying to develop this in the UK. I'm not going to name him right now until he's ready, but there is someone
Absolutely.
trying. And France
Absolutely.
also has a pretty big group, and France takes this very seriously. And side note, just in case anyone's not aware, our government takes this very seriously. They are definitely studying this. It's been mentioned by several public big figure people like Jim Semivan that they are part of a research study on experiencers right now done by the government. And of course, it was an OSAP. That was a whole nother thing, though. But Anthony Ross Kennedy.
Yeah. So, my focus is on the macro level piece of this. And, the bottom line, we're all here as a result of our government doing releasing videos and stuff. Right. And those came out of emails in 2015, official government emails talking about free energy and UFO disclosure, just crazy stuff.
Mm-hmm.
But for us, I've been appealing to my governing body for years now. And I worked at a national level. Right. And understanding that this is developing and whatnot, but I believe that our governing bodies coming together and going, wait, this is how it was, but this is how it is now based on new evidence. And we just need some people with more credentials or something, high level people saying, listen, governing bodies of these places, if we grab onto this, it doesn't take a real super intelligent person to go, what is that? What 0 point energy? And it's mind blowing. So we have to manage that. We have to manage the paradigm shift that's going to come with it. There's going to be a psychological paradigm thing that happens to us because of that. And so it's important that our governing bodies of our professions kind of grab onto this.
Right. So we have a lot of things that I feel personally need to be changed. I would like to also answer this question. One, I think the state boards need to be updated to allow some room for discussion about beliefs. Like it seems like there's a little bit of bias. I have a feeling if I looked up Christian therapy, like it would be out there and be okay. But a state board might have an offensive reaction to someone saying UAP therapist publicly. It's just a little biased, right, on the beliefs. Two, I think we need to recognize international cultural beliefs and respect cultural beliefs. I don't think people understand how just intrinsic entities, spirits, all of these things are for other cultures. Like it's just part of their culture, and people should not be diagnosing them like that just because it's part of their culture. It's bizarre. Also, I think we need to recognize just the absurdity of the stigma situation. Again, it was dangerous to not let people report. And I think we also need to ask for benefits for our veterans who and our active military who are getting exposed in these UAP encounters. I am beyond upset that that is not already actively in place. And I would like Congress to make some changes regarding that issue, especially because it is a part of the law that they look at this. So those are my thoughts on it. I get very upset about the veteran benefits, but so in our last moments today, I just want to give you a chance to say goodbye and let everyone know where they can find you. We'll go around again. Earl, go ahead.
What a wonderful panel to be part of, and thank you for inviting me, Deb. A good way to get a hold of me, well, they say not to give your email out, but I actually, you probably figured out anyway. It's earlgrayanderson@gmail.com if you want to email me, or you can find me on Facebook. I'm just there as Earl Gray, and you'll recognize me. And there you go.
Maddie?
Hi, thank you so much for having me on. This has been a pleasure. All of you have so much to add, so many beautiful things to add to the field. I am a member of Opus and MUFON, and if you get on opusnetwork.org and just fill out their little form, you could request consultation with me. I'll be glad to speak with you in person via Zoom. We could Zoom around the world. And I just wanted to add one thing that was not covered, but perhaps for a future show, and this is important, is that the contact experience is not just with ETs. There's a whole range of paranormal phenomena that goes with this, how people report strange things happening in their home, objects flying, lights
Yep.
turning on and off. The paranormal phenomena is real as contact, and often go together.
Yes, and I will say that I have snuck in some stuff on support for meditation experiences. That there's Cheetah House, I believe, is the name of a support group for people who have transformative meditation experiences. And Simeon Hine has support for Bigfoot experiencers. I don't have currently anything for poltergeist experiencers, but Opus covers that too. So, CJ, you're up.
Yep. Folks who are interested in getting in contact with me can just look me up at robinsonpsychologicalservices.com.
Davey?
Again, just to echo what everybody else has said, wonderful to be part of this panel. Looking forward to sitting on the other side of the screen next time and listening to more people discuss this. And if anybody wants to get in touch with me, you can find me on Twitter at Davey Johnston.
Anthony?
Yeah, thank you for having me on. It appears this is going forward, isn't it? It's going forward. So thank you. Holy moly. You can find me, Anthony Ross Kennedy, on every platform. I have Safe Space open daily on TikTok, where we come in and talk about anything and everything. And I definitely am talking to people about, the official UFO disclosure social work piece, but I'm also telling people about the very real Anthony Kennedy, his experiences live with everyone daily. So find me on any social media platform.
Thank you. And then June?
Hi, again, thank you so much. And it's been wonderful hearing and meeting the rest of you on the board here. I can be contacted through Opus if you go to the website, opusnetwork.com. My name and my contact information is on there, and I am always open to working with people, helping them, and trying to get them to where they need to go to get healed and to get heard. Thank you.
So I'm just going to pop up here for just a moment the website for UAP Med. If anyone's interested in being part of the coalition, I want to point out it is a coalition. We are not a competition. We are not a force that's going to tell you what to do with your own project or anything like that. We're trying to get everyone to work together to work on this issue so that we can educate the public, professionals who are treating experiencers. If you would like to be a part of UAP Med, it's free to join. There's, there's nothing weird. Like you're not like, I don't know. It's a good thing, guys. It's a good thing to try to help with this project. Okay. I don't know. I would really like it if people would consider helping with this. We really want to help. So thank you all for coming and helping. For us to talk about the UAP medical issue really shows, like Anthony said, how far we've come, and let's keep going. Thank you, everybody.
Thank you.
Thank
Thank
you.
you.
Thanks, everyone.